us here today. Today, I would like to discuss vaccine-preventable diseases and the importance of getting vaccinated, particularly in the setting of the current flu season. Immunization is a vital part to public health, and it is a priority for us at the Ministry of Health. We must protect our population against vaccine-preventable diseases. This is very important for Bermuda and an integral part of communicable disease control worldwide. Many diseases are preventable through vaccines, yet despite steady progress in the 20th century in preventing death and serious sicknesses from infectious diseases through vaccinations, the 21st century presents new threats from old diseases as a result of the growing resistance to getting immunized. In fact, the World Health Organization has ranked the growing resistance to widely available life-saving vaccines as one of the top 10 health threats in the world for 2019. It is important to note that many diseases have become rare in the region and in high-income countries because of immunization, which is, of course, very encouraging. However, we must not be complacent. While most people are aware of the benefits of vaccination and the prevention of vaccine-preventable diseases, many have questioned the value, and this is based on misinformation and misconceptions, inaccurate published reports, non-scientific social media posts, and all sorts of anti-vaccination stories. Choosing not to vaccinate against preventable diseases has resulted in a return of diseases we thought the world would no longer have to fear, such as polio, diphtheria, and the measles in particular, are all an increasing threat. If Bermuda is to remain safe from serious illnesses, everyone must get the facts about the vaccine safety and the need to protect themselves, their families, and the community against those diseases. This includes early immunization of infants and the completion of the full schedule of vaccinations up to and through adulthood. Vaccines do work. They are safe and effective and necessary in preventing certain diseases. Vaccines against polio, measles, mumps, rubella, tetanus, influenza, and meningitis, and so forth have been proven safe and effective over many, many decades of use. The risk of having a significant side effect from a childhood or travel immunization is exceedingly small, yet vaccines prevent 2 to 3 million deaths a year worldwide. Currently, we are in the midst of flu season, and there is a rise in numbers and in the severity of flu cases recorded on the island. I cannot stress enough how important it is to the public to protect themselves from the flu with vaccination, especially children, the elderly, and those with chronic medical conditions. These persons are strongly advised to seek medical attention early if they have any flu-like symptoms. Typical symptoms are fever, which usually is 100.4 degrees Fahrenheit, headache, chills, cough, sore throat, runny nose, body aches, feeling very unwell and tired. All individuals with flu-like symptoms should stay home and rest, stay home from work and school until at least 24 hours have passed after the fever has ended. The flu vaccine can keep you from getting the flu. It can help keep you from getting the flu, and it can make flu less severe if you do catch it. And, importantly enough, it can keep you from spreading flu to your family and to others, especially newborns and children, infants, seniors, and persons at risk of complications from the flu. Having the flu vaccine can help reduce time taking off from work and from school. Bermuda is also at risk for the return of measles due to current outbreaks in nearby regions, particularly in North America and Europe. I strongly encourage people who choose not to vaccinate to protect themselves or their children from preventable diseases to find reliable, scientifically sound information and to distinguish fact from fiction. The ministry is concerned about the influence of non-scientific information and hearsay, which causes some to resist the idea of vaccination. We refer to these as vaccine hesitancy. To this end, the Department of Health is working with its stakeholders in a collaborative effort to address vaccine hesitancy in our community. We have put together a working group to explore vaccine hesitancy, and further details of activities will be forthcoming during vaccination week in April. By skipping vaccinations, you are endangering your own life and the lives of others. By getting vaccinated, you are protecting yourself. You are also protecting your family, friends, colleagues, and the larger community. I feel strongly that if we all choose to get vaccinated against vaccine-preventable diseases, we will protect ourselves and our communities from from diseases that we should no longer have to be worrying about. Thank you.
Questions? Questions?
I have a question. You have your flu shot?
I'm in trouble. Hi, good morning, Ms. Wilson. Just wanted to check if you have at all any update on the people that were taken into the ICU unit with regards to flu complications that we were alerted to at the beginning of the week.
My last update that I received is that there are currently 7 individuals that are in the ICU units, all on ventilators. As you said, indicated the symptoms suggest that they are flu.
And no further since those 7 that we heard about earlier in the week then?
I do believe that there were additional admissions that are actually in the emergency department, but the total number of persons with flu, I don't have that information at this point.
And do you have any figures with regards to vaccine uptake, perhaps over the past year or so? Do you have those to hand?
I'm going to actually yield to the Chief Medical Officer. I'm joined by her and some of the other technical persons from the Ministry of Health to see if they can perhaps provide that information.
I can try, but it really is trying to just speak to the group. Yeah, some of the technical information is available, and I don't know if our manager for expanded program of immunization has them here today, but we certainly have a sense of the update, which is what you asked, the uptake for this season. Lynn, did you want to speak to that specifically? I think if you have the answer. Yes, why don't you? Yeah, share that.
Thank you. So as we know, for 2017, some of the general uptake for the immunization was around 79%. We have preliminary data that is around the 70-80% that we would expect by the third quarter of 2018. So as we get the rest of the information from this year, we'll be able to compile that. But thus far, we're looking at still between 70 and 80% for the coverage for at least 1 year of age.
Thank you very much.
Thanks.
Yes, good morning. Have you had any reported cases of measles this season?
Dr. Peatball?
Yeah. Absolutely not. We're happy to say measles is a disease we have essentially eliminated in Bermuda, and we want to keep it that way. It was a regional goal to eliminate measles, and the Caribbean was the first region to do that. But we are threatened now because, as you know, in many other parts of the world there are outbreaks, and there have been incidents of measles in other parts of the region, and certainly in North America and in Europe, but not in Bermuda, and we really want to keep it that way. And that is really the purpose of this conversation, is to let people know that there are ways to prevent vaccine-preventable diseases, and that in 2019 we don't have to be plagued with diseases that we really conquered the last century. And so I think that the purpose of the minister's statement is to encourage people to do the right thing and to believe that the science is true. Vaccines are safe, they're effective, and we should be preventing these diseases that were prevented 50 years ago. The issue of influenza puts this into present context. It makes us want to really point out that you can prevent serious illness on a seasonal basis from influenza because it is a vaccine-preventable disease. And we're hopeful that people will take this context that's very unfortunate, where people are getting sick and we're having a more severe impact than we ordinarily have with influenza, to be reminded that there are ways to prevent vaccine-preventable diseases, and it's by getting vaccinated.
But with a more severe form, it would follow that this flu shot doesn't always prevent the flu, yes.
Well, health is complicated. Nothing is 100%. No flu shot prevents flu in 100% of all people who get it. The efficacy varies, but one thing we do know is that it is typically it reduces your chances 50% or more. And it certainly reduces the impact of influenza. Your immune system is what really keeps you alive. You know, the immune system is amazing, and it is what mounts the resistance to an invading virus. And so that the vaccine helps to let your immune system get a forewarning, an advance warning, so it can do an even better job and a quicker job so you don't get as sick. It's about as simple as that, but the complexity of it is way beyond what I can explain here. But I think the point is, if you are vaccinated, you are then giving your body an early warning and an ability to mount an immune response immediately if you then get exposed to the virus. And nothing is 100%, but what we want people to have is the best chance not to get critically ill.
Okay, so I would wonder if you'd speak to the minister's tail end comment that the government's main initiative is to create public awareness or heighten it, when a lot of the information about vaccinations and parents opting not to use them, there's a big wealth of information now showing that vaccinations are being used in urban regions to inflict things like ADHD and things like that. It's big research on it, and
I'm
sure
afraid
you're aware of it.
I must say you have been misinformed. There is not any such research. I don't know what your sources are, but I would refer you to the scientific sources such as the Centers for Disease Control website. There is also a European Center for Disease Control website that you can reach out to. There's the World Health Organization website, and of course regionally, the Pan American Health Organization website. These are consensus, scientifically supported, peer-reviewed sources of information, and I would refer people to those. I can say that unfortunately social media puts everything on the same plane. It puts the highest level of science along with this, with hearsay and fabricated conspiracy theories, so that the unsuspecting public have a hard time figuring out what the truth is. And so what we're trying to encourage people to do is to go to reputable scientific sites that are not about creating fear and hysteria, that are really based on the facts. So in a word, I'd say the Centers for Disease Control website would be my first recommendation.
My last question is, what's the law with regards to vaccination? As a parent, how do I know every child in my child's classroom is vaccinated?
Well, I can tell you every child in your child's class is not vaccinated, and that is why we're here today. The goal is to have parents refer to evidence-based scientific sources of information, not what you hear in the streets or what someone might have put on social media, and then understand that the recommendation from the scientific community, from the medical community globally, is unified. Children can be helped by being vaccinated, and the community can be protected when a majority of people are vaccinated. The law currently is that there is a need for the parent to assure that children who enter school are vaccinated, and the Department of Health makes a very big attempt to document that on school entry, and to encourage and to educate parents on a one-on-one basis about the need for vaccination. But it is up to a parent to make that choice, and that's why we're urging people to make the choice based on scientific information from reputable sources.
Hi, good afternoon. You've touched on it already, but has the ministry been able to pinpoint exactly why parents are opting against vaccinating their children?
It's complicated, and I think as a parent, I certainly empathize with that. I remember 25 years ago, when I was new in my career, having some feelings of wanting to get the facts and questioning, and I think that's what every good parent should do. We're only suggesting that the facts and the information that parents obtain come from reputable sources, and I'm quite certain that the average individual reading the recommendations from sites like the Centers for Disease Control will conclude that the right thing to do for children is to have them vaccinated according to the usual recommended childhood immunization schedule. their pediatrician or general practitioner, and the doctors at the Ministry of Health can certainly give them the details about that. But the advice is clear and uniform across the medical community that children should be vaccinated. And we're here today generally about that topic, but also in the context of the current flu epidemic, which can be lessened if people get vaccinated early.
Measles was mentioned earlier. Have there been any instances of polio, diphtheria, other major illnesses on Ireland?
No, we are quite happy to say that not since the middle of the last century have there been reports of that, and because of vaccination, it is that very public health gain why we are encouraging people to not become complacent and to continue to be vaccinated just as they have been over the last 50 years, so we don't ever see those diseases here. But those diseases are definitely a problem globally in low-income and less developed environments where there isn't access to vaccination. But here we have access. We have absolutely no reason at all to ever see those diseases in Bermuda.
And will the vaccine hesitancy working group consider ways of enforcing vaccinations at any point?
I'm not a part of that working group at the moment. The person who is here, and I can let her speak more specifically, but I can say that the word enforce is not what we are about. It is about educating people so they can make really informed, good decisions. And we're quite confident that when people get the best scientific information, they will do the right thing. But if you want some more details about the plans in April, perhaps Lynn might want to share that, if you will.
Sure, thank you. So the vaccine hesitancy group is made up, first of all, of Department of Health as well as our key stakeholders in the community, health practitioners as well as other participants. And some of the working group activity right now is really collecting a lot of information, trying to understand what those concerns are from the public. So we want the public to know that we do hear your concerns and we will be responsive to those concerns so that ultimately we can actually move forward and build the trust to get that vaccination for parents and for children to increase our coverage so we can protect them. So those activities we're really very much in the preparatory work for that, and we'll be looking to talk more about that in April, the last week in April, which is vaccination week.
How do you differentiate negligence and being misinformed as a parent?
So you're asking about the misinformation of a parent? So let me answer that. What we want to do is get the facts out to persons. Part of why we're here today. It's really getting the facts for parents to actually be vaccinated and understand the concerns regarding vaccinations and be able to answer those questions. In terms of other aspects, we're building that relationship we want to with the community to hear those concerns.
Okay, thank you.
Thank you.
Thank you, everyone, for coming. Thank you, Minister.
Thank you.